So what causes endothelial dysfunction, which is the lining of the blood vessels on the inside? So this comes from International Journal of Biological Sciences, 2013. What causes endothelial function? Here's what they say. Endothelial dysfunction is characterized by a shift of the actions of the endothelium towards reduced vasodilation, meaning they're starting to constrict, a pro-inflammatory state, inflammation, and prothrombotic properties, meaning blood clotting properties. It's associated with most forms of cardiovascular disease, such as hypertension, coronary artery disease, chronic heart failure, peripheral vascular diseases, diabetes, chronic kidney failure, and severe viral infections. Interesting. Free radicals can disrupt the balance of nitric oxide damage, of nitric oxide that damage the endothelium and leave it overly permeable, allowing toxins to pass into body tissues. You guys ever heard of a leaky gut? Well, you can also have leaky arteries, and that has to do with loss of endothelial function by the inability to be able to make nitric oxide. If the body is depleted of these antioxidants, or if there are too many coexistent factors, injury to the endothelium and a change in the balance of nitric oxide may occur. If the endothelium becomes damaged, the nitric oxide levels become imbalanced. Cells that should remain in the blood can pass through vessels into the adjacent body tissues. Some of these proteins include C-reactive protein. Pay attention, very important to measure, which is produced by the liver and also causes inflammation. Several factors that increase the number of free radicals in the body include obesity, smoking, not getting enough sleep, having acute infections from bacteria, high glucose intake or high amounts of sugar. In addition to that, exposure to metals and also air pollutants. So what do they just see here? What causes endothelial dysfunction that causes the whole thing to start off in the first place? Smoking, not getting enough sleep, infection, high amounts of sugar, diabetes, and toxins. This is the very thing that we talk about all the time, is we talk about the reason why people get sick. So you have to understand that if your doctor just says it's just all about LDL, who cares about anything else? There has to be dysfunction. This is why you have to go so much deeper than just having a doctor throw a statin at you and tell you that everything is going to be okay.